Welcome, Mr. Meisner.
All right, thank you, Mr. Martino. Good afternoon, Madam Chair, members of the board. Brian Meisner, the Emergency Management Coordinator, joined by Ms. Case Miller, our Deputy Coordinator. Today we'll go through the same data we've been updating you on weekly, and then some updates on where we're at with our vaccination process. The current 7-day sliding positivity rate in the county for PCR testing is 11.4%. That number has been steady for the last 2 days that data is available, and that is as of the 12th. Again, there's a delay in reporting because they do not give us an average 4 days in which the data is incomplete. So at this point it is steady. The Health District and the Commonwealth continue to be in Phase 1B. This Health District continues to serve Groups 1, 2, and 3 of the distribution process in 1B, as well as those who are age 65 and older, 16 to 64 with medical conditions, and folks who live in homeless shelters or migrant labor camps. The next series of slides for the state vaccine data is as of Monday, 2/15. There were a little over 1.73 million doses that were received in the Commonwealth. As Mr. Martino noted, we are the second highest in Northern Virginia and the fourth in the Commonwealth with regard to the number of doses that have been administered. And the breakdown throughout the Commonwealth, again, the first graphic is the long-term care facility program, which is nearly complete, showing that nearly all of the doses it has been allocated for our congregate care facilities have been administered. And then the first doses and second doses equaling a total of just over 1.73 million doses distributed statewide. Again, the first dose breakdown continues to show a disparity between the amounts that were received by hospitals and local health departments, and that more doses were administered by medical practices, other community health providers, and pharmacies because of the redistributions that are occurring from hospitals and health districts to those other partners throughout the state. For second doses, again, we're seeing a similar thing at a slightly smaller scale where a variety of second doses have been received and people are currently being scheduled throughout the Commonwealth for those second doses. We just find it important to note that because once a second dose is received for a district, they have to ensure that it is administered to somebody needing a second dose. They cannot go ahead and give it as a first dose because that second dose will not be replaced in their inventory for the person that it is designated. So here's the statewide map. Again, as of yesterday in the Health District, there were 50,837 doses administered in the Commonwealth, in the district. Of those, 11,978 are people who are fully vaccinated, meaning they've received both their first and second dose. So now to our data for the Health District's vaccine inventory and their clinical operations. The Health District does continue to offer 100% of its allocation of the Pfizer vaccine to Novant in partnership with them for the K-12 school staff clinics that they've been operating. So that leaves the allocation of Moderna vaccine, which the Health District has been using and or redistributing to partners. So as of Saturday at close of clinic operations, there were a total of 24,250 doses of Moderna received in the district. Of those, 18,720 had either been administered by the Health District or transferred to community partners. So that leaves us a starting inventory for the week of 5,530 doses. I'll note that, again, that is first and second doses, so a number of those are second doses that have to be held until the person who needs that second dose is scheduled for that appointment. The Health District was notified to expect an allocation of 3,100 doses this week. Of that, they transferred 2,100 to community partners and retained 1,000 doses for a starting inventory of 6,530 first and second doses. Of that inventory, they have a total of 3,600 appointments available for the week, and the majority are currently filled. That breakdown is 360 appointments, which were the last 360 appointments in the VAM system at Beacon Hall on Monday, and then 1,800 manual appointments from Manassas Mall through Saturday, and 1,440 manual appointments for Potomac Middle School through Friday. In terms of our planning assumptions, we continue to work through our unified coordination structure with the Health District and our partners in Manassas and Manassas Park to plan for future clinics. We are planning to continue to operate the west site at the Manassas Mall, which opened today. It's currently operating with 12 stations due to the limited vaccine that's available. However, that site can scale to add additional vaccine stations and vaccinators. and we are currently in initial discussions with a very large freestanding retail facility on the east end that will have a significant amount of space, much more space than vaccinated vaccinators will be available when we hope that facility opens in the next few weeks. The partnership with Safeway is continuing at Veterans Park. They will be adding days to begin their second doses starting this week. So they added Friday, and then we'll be going Monday through Friday next week, still averaging about 200 a day and still booking only from the wait list. The CVS Federal Retail Pharmacy Partnership does continue. It is still just the location in Gainesville, but we understand that the state has received word that they are looking at the next allocations that CVS will be receiving and starting to look at some additional sites that might be able to be added. We don't have any confirmation about when that's coming. And finally, just to note that the manual booking procedures we're using are stable despite the transfer to the statewide pre-registration system, and we continue to assist the health district with manually booking those appointments. So in terms of the wait list, as I'm sure everybody has seen, there is a transition occurring to a statewide pre-registration system. At the direction of the Virginia Department of Health, we shut down the wait list for the health district at 5 p.m. Friday and securely transferred all the data to that statewide system. There were 52,995 people who were on the wait list for their first dose, as well as 10,576 people who were pre-registered in our wait list for a second dose. Of those numbers, prior to the transfer and as of this Monday, there were 2,780 who have been scheduled for a first dose, which was an increase of 1,548 people from last week. And there were 938 scheduled for their second doses, which was an increase of 515 people scheduled for a second dose over the last week. So the statewide call center is up and operating as it has been. It has dramatically scaled up for more capacity. And at the direction of VDH, all waitlist and general COVID-19 questions are now being forwarded to the statewide call center at 877-ASK-VDH3. The local call center continues to help with testing and test result questions, as well as placing those outbound scheduling calls to people based off of the waitlist data. Finally, just before we conclude, I want to share briefly an exciting new outreach campaign that our communications team has developed, specifically encouraging folks to continue our mitigation measures of masking up, spreading out, and making sure that you can get the vaccine when it's your turn. So there will be some targeted advertising and media that will be launching in early March. So stay tuned for more updates on this, but we're really excited to see the campaign that our team's put together and look forward to sharing it with the community. And with that, we'll be happy to answer any questions you may have.
Okay, I was going to say you were early on questions, Supervisor Franklin, but I'll start with you.
Sure. I have a couple of different questions. Did you say that we were the second in the Commonwealth in terms of receiving doses?
Fourth in the Commonwealth in terms of doses administered, and second in Northern Virginia in terms of what's been allocated.
Okay. And then can you just go over very quickly, as of today, what are the current vaccination sites and what are the current testing sites?
So the current vaccination sites, as of today, are Potomac Middle School and Manassas Mall. Those will be operating for the week. We're in the final stages of planning next week's clinic capacity with our partners in the health district, and that'll be announced later this week. The testing sites are posted on the county's COVID website, coronavirus.pwcgov.org/testing. I'd have to check and get back to you on the exact
Sure,
sites.
but we're still operating our testing sites.
Yes, ma'am. We are still operating the sites.
And then I'm going to page 9 here, but can you tell me out of the phase 1A, which I think we're still at, how many people are still in line to be vaccinated from that priority group? I'm seeing here that doses administered are about 50,000, fully vaccinated 11,000. How many are still on the priority list right now to be vaccinated?
Sure, thanks, Supervisor Franklin. So last week we cleared the backlog of 1A up to the point where the wait list closed at 5 p.m. Friday. Folks could still add themselves to the wait list for the first time, and if they reported they were a healthcare worker, they were immediately called and accommodated. And because of that, 1A is now completely clear.
Okay, in Prince William County?
Yes, ma'am.
And do you know when the state is planning to move to phase 1B?
So we are also concurrently in 1B.
Gotcha.
There was a backlog in folks needing to be registered for 1A based on the vaccine availability because of the VAM system challenges where all the appointments were taken. And as we added the manual capacity over the last 2 to 3 weeks here is when we worked down first the priority of second doses, then 1A, now in 1B, focusing specifically on those who are 75 and older.
Gotcha. And then from the group that's in 1B, how many of those individuals are in 1B still left to be vaccinated?
So for the data that we packaged up and sent to the Commonwealth on behalf of the health district was exclusively registration data from only 1A and 1B. So that number of 52,000 and change would have been folks who were only 1A or 1B.
Okay. And then we've received, and we've on the board here talked about some of the demographic data, and I'm assuming hopefully you kind of addressed that a little bit. I didn't see anything with regards to your presentation, but if we can talk a little bit about demographic data, and if our vaccinators are asking, like what ethnicity, if they can, and then recording that data and submitting it, where are we with demographic data? And then I just also say, leading to that point, we've received a lot of emails from various residents who are in some of our communities, particularly communities of color, who are in those priority groups, who have expressed concerns about not being able to get an appointment date. And I think that goes back to the discussion that this board had last week with regards to making sure that not only are we vaccinating people who are in that priority group, but making sure that the vaccines are being distributed equitably. And so I would like for you to address that and kind of tell us where we are or how much information we have.
Sure, thanks for the question. So in terms of the demographic data, the waitlist data that we packaged up and transmitted to the state only had partial demographic data, and that was based on when the health district directed us to start collecting it for them. So of the 52,000 or so first dose records, roughly about 11,000 had the demographic data, and that was transmitted up to the state pre-registration data set. That's just the wait list or the pre-registration portion. Whenever someone arrives at a clinic for their appointment, regardless of what provider type, whether it's a hospital, a local health department, a pharmacy, or another community health partner, when they are being vaccinated, the state health department has asked that clinical staff to collect demographic information on that individual and report it to the Virginia Immunization Information System as part of their first or second dose vaccination record. And there is now also a state dashboard. Unfortunately, it is only statewide in nature. It does not let us drill down to the health district, and we believe that the data source for that dashboard is that VIIS system.
Okay, so just in layman's term, have we been collecting demographic data?
We are not clinical providers, but the clinical providers who have to sign an agreement with VDH to receive vaccine and administer injections are being told by VDH they have to ask the question. Someone can give a decline to answer, but they have to ask the question.
And so for those that are currently going in to get their actual shot, those vaccinators are being told that they must ask that question. I guess the question for us is, can we go and get and retrieve whatever that data is for the breakdowns?
So we will drill down on that question with the health district and with our partners in Richmond. The data set is posted in the aggregate statewide now, but we don't have access to it at the district level, so we'll ask the question to find out when that might become available.
Sure, and Chair Wheeler, I'm not sure if this is appropriate now, but I do have a directive to issue with regards to receiving that data, because I want to make sure that we actually do it, and I don't know if it takes a directive from the board to actually get that information, and if you guys are having trouble getting that from the state, that's something we need to know so that we can directly reach out to the state for that information, because we've been talking about that for a while. So I'm happy to issue the directive now or wait, but
Go for it now, sure.
sure. So I want to issue a directive to have our equity working group, which I think is part of Chris Martino's leadership team, to really work with the health district to retrieve this demographic data. And then also to come up with a plan to make sure that those that are signed up in these priority groups, that the vaccines are being distributed equitably. So whatever that looks like, whatever that means, I think we need to just get some actual details on what that looked like, if we don't have that already, which it sounds like we don't.
Madam Chair.
Mr. Martino?
Yes, ma'am. We'll do that. We've been trying to get that data, but as Mr. Meisner has indicated, it's not available at the local level yet, and we'll keep pushing. And I would also add, as you indicated, if there's folks that you can speak to in a delegation or elsewhere in Richmond to make that data available to local jurisdictions, I think that would be constructive.
And if I may also add, and I don't know if someone else suggested this, but, even if the board sends a letter to whoever appropriate to say, we request this data, however we need to get this information, I think we need to do.
Madam Chair?
So maybe, Mr. Martino, you can find out who that is and draft it, and we can send it. How about that?
Sure, it might be
That's
the
easy to
Secretary
do.
of Health or someone at VDH, but we'll follow up on that.
And that's in addition to the actual directive, because
Got it.
Okay. So Supervisor Lawson, then Supervisor Angry, and Supervisor Bailey. But if Supervisor Angry, if you have questions, is this on this topic or you just have questions? Because Supervisor Angry pinged me for a while with general questions.
Well, yeah, it's.
Okay, yeah, Supervisor Lawson.
So, a couple things. First of all, I'm hearing that the health district did not require, or they weren't even asking, because you said 50,000 vaccines have been distributed, administered, but we only have 11,000 that we've captured the demographics, correct?
Correct.
But
So-
that was the
so there was a
instructions from
while-
VDH.
I'm sorry?
I'm sorry for, Madam,
Please,
that was
yes.
the directions from VDH, so the local districts were not asking those questions
Right.
initially,
Right.
and now they are.
Okay, and that's why I'm trying to weigh in, like, why would they have not asked us from the very beginning? That's on a simple patient form when you go into the doctor's office for a sore throat. Why would we not be captured, and not we as in the health district? The health district's taken direction from the state.
Correct.
Is there a question?
Yeah, so my question is there absolutely is, but please don't cut me off because you're interrupting my train of thought. My question is who has the governor tasked in his administration? I can't remember the person right now, but Supervisor Franklin, that's who I think we need to pick up the phone and call that person and say, look, direction and leadership is coming from Richmond to the health districts. And so that's my question. It's probably not to Mr. Meisner. It's who do you recall who it is?
I'm going to defer to Mr. Martino, but yeah, I think a letter and picking up the phone is a good idea.
Sure, and it might be Dr. Avula, who the governor's put in charge of
Yeah,
the,
who is it?
Dr. Avula,
Dr. Avula, and then
Okay.
who's put in charge of the entire vaccination process. And so we'll reach out and see
Well,
how we can connect.
No offense, Mr. Martino or Mr. Meisner, but I would suggest that the chair and Supervisor Franklin, you also call, because frankly, you're going to have more persuasion with them, I think, than some of the other folks, because he's tied to the governor, you have close ties to the governor. I just think that it's probably going to be more efficient and effective if you all make the call. I can make a call, but
I'll
I don't
gladly
think it's
call. I've also been working, there's a director of diversity and inclusion, Dr. Janice Underwood, who I've connected with somebody else. And so, yes, I've already sort of been doing that. I'm just not
Yeah.
broadcasting it. But yes, we can make that more public.
Yeah, no offense to Mr. Martino, but I think you're going to be faster with results.
Understood? Great. Supervisor Bailey, did you have anything on this before I go to Mr. Angry, Supervisor Angry?
Yeah, just adding, I think that's an excellent idea, and for, I should say Dr. Martino, Mr. Martino, Dr. Favula has a town hall every Wednesday at 1 o'clock.
Right.
So that's open to all of us to participate in and ask these specific questions that we have from the dais right now.
Thank you, Mrs. Franklin. That's an excellent suggestion. We'll get that link out to all the board members because that's a good source of information right from Dr. Avula.
Yeah, absolutely. And then may I continue, or shall I?
Yeah, Supervisor Bailey, and then I'll turn to you, Supervisor Angry. Just hold those questions. Thanks.
Thank you, Supervisor Angry. Thank you, Madam Chair. I just wanted to, I wanted to piggyback on something, and not piggyback, but support what Supervisor Franklin had said in terms of the demographics. That's very key in case this pandemic, heaven forbid, comes up again. We need that kind of data. So at a local level, we'll know what we're dealing with, not to, belabor the point. But are there any special dispensations for, I've gotten a couple of emails and calls this week with people with critical illnesses, like one of my citizens had lymphoma. One has brain cancer, stage 4 brain cancer. So how do we direct them in terms of that? Because we can tell them to call and get on the list, but, do you have any recommendations from the VDH that we can support in that regard? Because I'm going back to something Mr. Egger said earlier in terms of, the vulnerable, that's a vulnerability. And then the second question I had in terms of, I know you said one of your bullet points was on the Eastern Corridor, there's a large freestanding retail site identified in negotiations. In negotiations for monies and negotiations for logistics, that kind of, can you just enlighten us? No, you don't want to give out the name, but can you enlighten us with that kind of information?
Sure. So to your first question, for the folks who have extenuating or challenging circumstances, we recommend that if they have an established healthcare provider, they make sure that their healthcare provider is aware that they want to receive vaccine. They're typically the best able to advocate for their situation, and the healthcare community does have a way to reach the health district for critical cases like that. It also would be beneficial to make sure they're in the waitlist system. And we will also ask Dr. Ansher and her team that question of if they have anything else available for those extenuating circumstances and get back to you. Yes, ma'am. And for your second question, so just in negotiations with a lease or license agreement for the space. So, I mean, there's not any particular concern. It's just working through the formal process, and we don't want to share details until it's finalized.
But that's encouraging. Thank you.
Yes, ma'am.
Supervisor Angry?
Thank you, Madam Chair. Hey, thank you, Mr. Mizner. Again, I'm gonna start from the back end of this, and that is, so we're now in the game phase of vaccination, but we still can't take our finger off the pulse of COVID-19 positive rates. And so the slide that you have that shows vaccinations, I like, and I don't think this needs to be directed because I think the board wants this as well. We need to add back that slide that shows how many we have tested positive and literally the death rate. Because I know for last month, January, we lost 57 people. Already since Valentine's Day, we've lost 14, 14 for this month. So I think it's critical that we keep those numbers in front of us so we know what's going on, so we don't lose sight of what's going on here and everybody's focusing on vaccination and to the point that we're still having this high positivity rate of testing. So I'd like to get that slide added back in the deck if we could.
Yes, sir.
Yep.
Okay, and then now just a couple questions for you. The 1A scheduling for, you said you pretty much at ended that, you're in 1B. True enough, if people sign up right now and they're 1A folks, they're gonna get pushed to the top of the list, which means everyone on that list is going backwards, correct?
In principle, we have been told that they need to be served with priority. However, registration is currently paused at the district level and is at that state list, and the district is not yet receiving data back from the state. So we're booking off of the data as it was when it closed at 5 p.m. on Friday.
Okay, and the reason I say that is because we get a lot of calls from folks that says, when am I going to get my shot? When am I going to get my shot? I think the reality is that there are folks that are coming on this list, signing up now, whether it be a first responder or someone 65 to 65 and older, or someone with an underlying condition. Those folks are getting bumped to the top of the list. And I think people need to understand that. But I also want them to know that come March, April, which I'm really hoping Johnson & Johnson gets approved, that we will see an influx of vaccination, and then those numbers will grow rapidly towards the end of the month. So to your point of your last slide, where you talked about your marketing campaign of, wash your hands and, CDC guidelines, I think we really need to, for the next 30 to 45 days, focus on that and push that home, because those are areas that are of significant concern. And then just moving on, I need Mr. Eggers, Ken Eggers, who spoke earlier. He called me, we had some conversation. I'm glad he called in. He sent an email to the board. We really need to get into an area of being proactive. And here's what I'm asking about. He talked about folks that want to help and be involved, get some of these parking lots. What is our game plan? If we don't have one, we need to start literally putting a game plan together about how can we utilize our constituent bases in our districts to help us get this. Because to his point, this is a national emergency. This is a national crisis that we need to start outward looking at how we can handle that. So do we have a game plan for that? And if we don't, we should work on one, I'll say.
Thanks for the question, Supervisor Angry. So we continue to have a variety of sites that we've already visited and pre-planned. The constraint is still vaccine supply. Only 3,100 new doses were allocated to the district this week, and the health director continues to want to focus their clinical efforts on 2 fixed sites so that we can keep working off the wait list. I certainly recognize there's other considerations that we need to make sure we're working in terms of equity and access to vaccine. So if folks are looking to volunteer, the best way to do that is through the Medical Reserve Corps. You don't have to be a clinical volunteer. They also take plenty of folks who are just helping in an administrative role, whether it's registration or greeting or just flow control and helping folks progress through a clinic site. Our MRC volunteers are putting a lot of good effort in there. And then in terms of facilities, if someone is interested, we'd ask that they either work through you all and our government liaison officer, or they can reach out to the EOC team, and we can make sure that it's on a list of folks who are interested to offer the facility. There are a variety of things we need to plan, and we are looking for larger facilities that we can grow into as supply increases.
And just real quick, Frank, because you got a good point on that. I remember we had asked for like maybe a cheat sheet or something that we could actually send out to our folks to do this. And I think that helped Mr. Eggers out, because he was talking about really trying to drum support for folks who want to be a part of this. But I don't know if you ever sent that sheet. I know we get a lot of emails, so if you did, I apologize. But if you have the contact information for our Medical Reserve Corps and literally what you just said just now, if we can get that again, so we can send that back out and maybe post it on our sites and get people really involved. And then the last thing I'll just say is this. I'm going to continue advocating for our clergy and our pastors, because right now with our death rates happening and a lot of folks getting sick, they're out there in these streets and they're really ministering to our citizens. And honestly, they should be somewhere high on this vaccination list. I know I brought that up before, but I don't know what the answer is, what we figured out about that, and if that's something that we need to work with the state about. But I think we need to take a serious look at our clergy in Prince William County and get them on a priority list to get vaccinated, because they are out here in the streets working with our most vulnerable. Thank you, Madam Chair.
Madam Chair.
Thank you, Supervisor Angry. Supervisor Vega, then Supervisor Franklin.
Thank you, Madam Chair. Since we're on topic, Brian, I just want to make sure that the data will include the demographics of those in tiers 1A and 1B.
The data from the state pre-registration system?
Yeah, because I think it's extremely important, so that way we know what discrepancies actually exist and so forth.
Yes, ma'am. We'll ask the question, and we'll kind of frame it as all data available, whether it was pre-registered waitlist data or what was collected at the time of administration.
Okay, thank you. And then last time that you presented to us, I asked a couple of questions in terms of our population and the number of doses that we received. And so we keep hearing that doses are being administered to Virginia localities based on their population. However, when we look at Alexandria, Arlington, Fauquier, Fairfax, Loudoun, and Stafford, Prince William ranks second to last in doses per 100,000 residents. And only beating out Arlington, which is, as we all know, they have a very young population, comparatively speaking. So with that being said, what do we tell our residents that are emailing and calling our offices what the reason for this discrepancy is?
So we will ask the state to kind of affirm and clarify, but unfortunately it's a result of the allocation change that happened January 21st. So prior to that, hospital systems and health districts and other providers were kind of all in the same situation for how they could request and receive allocations, and those decisions were being made more centrally. Unfortunately, because some of the larger hospital systems are up in those localities, that's how the doses shipped are being reflected as being sent to those localities. I believe Centera's doses, for example, are probably actually reflected in Norfolk because their central lab and pharmacies in Norfolk, and then they're moved up here. So unfortunately, it's very hard to merge those two together. But as of the 21st forward is when VDH made the change, with the local health districts having authoritative decision-making power about what of the 5 provider types would receive the allocation moving forward for that week.
Okay, we have the data there, and it's important to notate that Fauquier and Fairfax are both doing about 30% better than we are in terms of getting shots in people's arms. And so, if it requires for us to regroup to figure out, what the path forward is, I think that we have to closely analyze the data that's available to us so that we can really get things under control here in Prince William County for our folks who have been waiting for a long time. Also, are there any plans to reconfigure the numbers so that we can give residents some sort of indication where they stand in line that continue continues to be an issue, for my constituents, in terms of we need to know, where are we? They thought that the number that they were initially given was their place in line, and we learned that that's not the case. So I think we need to do something to fix that ASAP.
So yes, ma'am, thanks for the question. We were working towards that with our data set. Unfortunately, it's been transitioned to the state now. We're told the state is going to be doing some deduplication and actually checking against the VIIS data so that if somebody ended up being administered through a different provider, they're pulled off of the wait list so we don't waste time trying to contact that person. So we're at the mercy of the state providing data back to give some insight. Unfortunately, we do know that the site went live eventually today. It was probably just a load volume initially, and it sounds like it won't be until March until they're actually communicating out to folks what the status on the state wait list is. And it is at least live for you to go verify that your name is on the state wait list as of today.
Okay, and then my final question is, the newest new sign-up form, does that enable folks to sign up for their second dose online, or do they still have to call the call center to register?
So for the state side, we don't have that answer. The state is still moving toward the PrepMod system, and PrepMod, we understand, will allow for the second dose pre-registration process to be seamless while they're at the clinic for their first dose. We're still in manual mode. We're not in PrepMod yet, and so we continue to be in this period of time of VAMS has ended, PrepMod has not started, everything is manual, which is why we have the second dose pre-registration process for the folks who receive their first dose at one of the health district clinics.
Okay, so then our response to our frustrated constituents is what?
If they did not complete the second dose pre-registration form on a tablet before they left the clinic site, call the local health district call center and ask that they be added to that list.
So they got to call the call center.
Yes, ma'am.
Thanks, Brian.
Mr. Meisner, I have a question just to clarify something that Supervisor Vega said, because I got confused, and I think I don't want people to misconstrue it. You know, the idea that we're 30% behind in overall shots in arms, like places like Fairfax, really is because those numbers were skewed in the beginning when they were getting more doses at like Inova and things like that. We're still not, we're not 30% behind our local in terms of getting shots
I didn't say
in
behind, I
arms.
said they're doing 30% better than us.
So what does that mean? Because I don't think they're necessarily doing 30% better us on a weekly basis and getting shots in arms.
We'll need to go look at the state data again.
Yeah.
I mean, based on how we're reading the state data in terms of doses being administered, we're the second in Northern Virginia. Fauquier would not be in the Northern Virginia statistics, and fourth in the Commonwealth. I'd have to look if that was on a.
So we're second in
basis
Northern
or
Virginia in
cumulative.
terms of getting shots in arms. I just want to be clear that people don't get misinformation out there. Thank you very much. Supervisor Franklin had a thing, and then we'll work our way down with Supervisor Lawson,
Madam Chair.
Supervisor Bodie,
I don't
Supervisor.
think you've gone yet.
Okay, then fine. Supervisor Bodie can go next if you don't mind, Supervisor Franklin.
Thank you, Mr. Meisner, as always, for the presentation. I just have a couple questions. First, now that we are becoming more integrated with the state, how much are we interacting with the state level state health equity work group that's been stood up by the state in order to look at some of the disparities in terms of race, demographics, so things of that nature?
Yeah, thanks for the question, Supervisor Bodie. So we know that the health district continues to be in touch with them. We see some distributions coming out for them in terms of a lot of the planning and policy related things that they're working on. We have not seen specific clinic opportunities or anything like that, but we will continue to engage and look for those opportunities along with the directive of just working with our local groups who are making sure we've got equitable access.
Sure, thank you for that. And secondly, can you dive into a little bit more about how you guys are still collaborating with the school system in terms of vaccinations, testing, things of that nature?
Sure. So on the vaccination side, the agreement that the health district reached with Novant continues to be in place with the Pfizer allocation. They've been operating clinics at Unity Reed High School the last several weekends. The 3 school divisions on the public school side are working based on their priority and risk levels to refer staff over to those appointments. And then the Mason and Partners Clinic continues to work through the lists of private school teacher staff as well as child care workers for those folks to be accommodated as well.
Sure. And how that then linked to obviously the school board continues to work with the school division on reopening schools, sending kids back, what have you. Can you talk a little bit about how that coordination is working out?
I'd have to refer that to Dr. Ancher and her team. I know that she speaks weekly with Ms. Hubner, who's the point of contact for the school system on all their data and metrics, and I believe they're meeting this evening to discuss that.
Sure. 2 more questions. Are we still holding back doses for second shots?
So a small portion of the inventory is a second dose inventory that was received. So if we go back to slide 9, So this week, the starting inventory would be 6,530 first and second doses, with plans to administer 3,600 of those doses. So that leaves about 2,930, a 2-day buffer of 2 clinics at 375 a day, which is the average that they're trying to make sure they have a buffer, is about 1,500 of those doses. So that's their buffer for Monday and Tuesday of next week in case the shipment's delayed coming in next week. And then the balance is second doses that have to be held until someone arrives for their second dose appointment.
Sure. So even though the state insists that they're going to be allocating doses, second doses based on what's already allocated by that first stock, we're still keeping some in reserve just in case as buffer and logistics and stuff like that.
So the slight buffer or reserve that is there right now is as a result of how the district ordered vaccine in the early phases. It was not weekly because it was that kind of all-in-one pot process of folks were going direct to VDH. So the initial orders that the district placed first for our EMS providers and then for some of the additional unaffiliated 1A healthcare providers had a chunk of 5,000 in there, and those 5,000 came on time 28 days later, and some of those folks are still kind of cascading through the scheduling process. Some of the weather challenges over the last week or two have delayed a little bit of that. So it's not a large amount, but there are still some second doses being held.
Appreciate that. And my final question, obviously we're finally getting to a place where there's a unified sort of intake form for folks. Obviously, one of the considerations that are being put in priority are people with serious medical conditions, things of that nature. How are folks being asked now with the unified form how they have serious health conditions, and how does that affect where they're put in line?
We'll have to check and get back to you on that. The site only became responsive around noon today. I've not clicked through it myself to see what that is like, but we understand that it will ask those same questions to appropriately determine the age range or if someone has a medical condition, and then whether they're an essential worker, and if so, which category they fit in.
Sure, because I'm getting some concerns from constituents saying, hey, early on in the process, I may have filled out this form. They didn't really ask specific questions. I've heard other folks filling out other forms that have gotten the detailed, drilled down questions that prioritize them. And so I'm just curious to see, now that we're funneling in, how that works.
And we're hearing there are similar challenges from the data sets in other districts as well. To Supervisor Lawson's point earlier of the initial system really only asked for first name, last name, email address. And the working assumption was always that a lot of the data would be collected at the point of vaccination. And then once it was apparent there was going to be a backlog with the decisions that came rapid fire about who was eligible, is when they determined they wanted to collect more data up front at the wait list side. So they're working through it, and we'll keep asking the questions and bring back as much information to the community as we can.
Appreciate that. Thank you.
Supervisor Franklin, Supervisor Lawson, and the Supervisor Bailey can take us home.
Sure, and I'll make it very quick. I just want to make sure that I'm clear in what my asks are and that it didn't get kind of jumbled up in a discussion, but obviously I issued the directive. We'll consider maybe a letter from the board. And then, obviously we can always kind of call people, but I just want to be clear. I can't just pick up the phone and call the governor or his people. I don't know. I don't have that much power. But I certainly talk to people in the General Assembly, and I've already had some of these discussions, but I don't want people to think I can just, snap my fingers. I wish, but I can't.
I thought you could.
No.
Thank you, Supervisor Franklin. Supervisor Lawson.
Thank you. Well, I have confidence that you can make some things happen, Supervisor Franklin. I did learn, actually my aide participated in that town hall that Supervisor Bailey mentioned last week, the governor's town hall, and what she reported to me is that it was indeed CVS that chose that one location in Prince William County. I know that 8 of us took some heat for that, although none of us had anything to do with that decision. I just wanted to make that clear that it was revealed in that town hall that was a choice made by CVS for whatever reason. I don't know, but I wanted to clear that up again. Supervisor Angry, I agree with you that we need to advocate for the ministers to be fast-tracked, maybe bumped up on the priority list. So if everybody's okay with adding that to Supervisor Franklin's request, I don't know how we go about that. Maybe make some more calls on what were you going to say, Mr.
I would
Meisner?
just recommend that the state needs to give clarity as to what group that they would fit into and give consideration to Supervisor Angry's concerns of placing them accordingly.
Okay. Yeah, I agree with you, Supervisor Angry, and you have been beating that drum the last few weeks, so I agree with you on that. Brian, so Beacon Hall was used yesterday to administer 360 vaccines. Is that right?
Yes, ma'am. So that was the last day that was scheduled in VAMS. It was part of that cutoff process that we realized there were the cascading problems of appointments being filled.
Right,
so
but they
just
were
picked the
able
middle of
to?
the month.
They were able to administer 360?
We don't have the final count from the day, but 360 were booked for the day, and we did not hear any reports of,
Okay.
of folks not.
So will
providing
they
or not filling.
continue to use Beacon Hall, or?
So that is transferred over to Manassas Mall for this week.
Okay.
And we're talking with our partners in the health district and the two other localities about what next week looks like. So
Okay.
for this week, it's Manassas Mall for the rest of the week, and then Potomac Middle School. And we're working through that process for next week's announcement.
Okay. And then what are we doing to communicate to the public these two new locations, Potomac Middle and Manassas Mall? I appreciate the efforts that the communications team, and is that the Prince William County Communications that is working with EOC?
So there's a joint information system that's comprised of the public information officer from the health district and the
Okay.
PIOs from the two cities in the county
Okay.
that work collaboratively. There is an information update that goes out, the same updates that are being shared with the board, and whenever there's a clinic change, we're making sure to highlight it in there. The most important thing, though, is that because everything is by appointment only from the wait list, people are being told which site to come to at which time and getting a confirmation email the night
Okay.
before so that they make sure they understand where to go for their
So
appointment the next day.
Okay, so my question is, can we anticipate, it seems like there's always so much changing.
Sure.
Can the public anticipate that vaccinations will be at Manassas Mall for the next several weeks, or?
Yes, that is the plan, to try to centralize in an east and a west site. So we anticipate being at Manassas Mall.
Okay, so
for a while.
I guess my question is then, how is that communicated to the public so they can get in the mindset that now it's at the Manassas Mall when for a few weeks they thought everything was going on at Beacon Hall?
Sure. So
Or Potomac Middle?
so Potomac Middle will likely be changing because hopefully students will be coming back to the classroom here before the end of the month. So we will make sure we continue to clearly communicate through that joint information process, the joint information system. And then, again, the appointment confirmations will have the specific location that they're expected to come to for their first or second dose. And we're hopeful as Prep Mod comes online that second dose registration process will be transparent there at the site. And hopefully they'll be coming back to the same site 28 or 21 days later, depending on the vaccine.
Okay. I think that's all I have. I just want to thank you and your team for everything that you're doing. It has been a very difficult year on all of you, no doubt. And I think you're doing everything that you possibly can. And you're working with, decisions that are made in Richmond, decisions that are also made by the health district. And I don't know what the health district would do without you, Brian, and your team.
Thank you. We appreciate the support. It's definitely a team effort.
Madam Chair, I have
Supervisor-
something before Supervisor Bailey can bring us home, like you said.
Sure.
Based on the numbers that I gave, Fauquier County has administered 11.6 shots per 100 residents, whereas Prince William County has administered 9 per 100. That's a 30% difference per the Virginia Department of Health. And lastly, Fairfax had administered 11.5 per 100. That is 28% higher than us. Is that correct, Brian?
I'd have to check.
Okay, and
So
just
is that currently, is that the current week,
yeah, that is per the Department of Health latest numbers.
overall,
Yeah, that's what they say.
since the beginning?
I'm not sure since the beginning, but those are the numbers that they released.
I think that's since the beginning, but
And
okay.
so it's also published in Inside Nova and also by WTOP, if anybody in the public wants to know. Thank you.
Supervisor Bailey.
Yes, Brian, I echo Supervisor Lawson's thank you for you and your team, because I know it's a struggle, and we ask you the same questions repetitively over and over each week, but because we do want to make sure that we're partnering with you and serving our communities and answering their questions, that's real important. But I wanted point of clarity, please help make this clear for me as well as for our citizenry. Did you say that we won't hear until around March as to where people are in terms of the numbers?
Yes, ma'am. So a VDH press release stated that it will not be until March where they are giving an outbound communication to folks with this new state pre-registration system. So it is live as of today. It became responsive midday around 11:30 or noon. So you can go on the website to check. It's vaccinate.virginia.gov to make sure that you're on the list. But in terms of them initiating a communication out to you to tell you that you're on the list and perhaps some more context as to where you're at, the release said that would not occur until March.
Okay, and we appreciate that, and you know, that's managing the expectations with our communities, and I know it's hard, but we want to make sure that that everyone knows we're relying upon the VDH for these answers. And I don't know the level, and I had this discussion with Mr. Martino, the level of influence that we might have. No twisting of arms, but a lot of influence. As much as you can, you and your team, I know you're doing so as well, being as influential, because I do know that there are some specific churches, as to what Supervisor Frank Angry was saying, that are very interested in not only getting the shots, but to provide a retail service for us in the community. And so we need to have as much influence with that and the relationships that we have with the churches to make sure that we're serving at that level. So I just want to offer you that when you're talking to the VDH.
Yes, ma'am. And we have had our initial conversation with our peers in the health district and the localities about that process and how supply interacts with that process, and we'll continue doing so and bring as much information back as a kind of a timeline expectation as we can give you.
Yeah, I'm sure you have. Thank you. Thank you.
Madam Chair.
Yeah, I do have two questions, but why don't you go and then I'll
can
finish.
wait.
No, you go. I'll finish.
So I've been sitting here thinking it's been about a month since we have heard from Dr. Ansher. I think she presented to us a month ago, and I would request that at our next board meeting, we hear directly from Dr. Ansher on the vaccinations, because, you know, you're very vital to this, but frankly, the leadership from the health district rest on her shoulders, correct? Is that correct?
Yes, ma'am.
Mr. Martino, is that correct? Is Dr. Ansher, like, she's the leader of the Prince William Health District. I mean, Brian is working closely with her, but so much of this vaccination rollout really falls on her shoulders, correct?
Dr. Ansher is the executive director of the health district, and she's running the show, so to speak.
Yeah.
We and the cities are supporting her.
Right.
As we have for the past year in every way we can. And the logistics and helping to set up the sites and the call center and the scheduling, et cetera. So we will arrange to speak with Dr. Ansher and have her at the next meeting. If that's
I think that we'd appreciate that, because frankly, I think the numbers would be worse if it weren't for you, Brian. And I don't know who she reports to, but who does she report to?
down in someone in Richmond, VDH.
Okay. Well, that's who needs to get those phone calls from us, because frankly, I'm just going to come out and say it. I've been frustrated with her lack of leadership in this. So that, Brian, I think you're doing a great job. I cannot say that about Dr. Ansher's leadership.
Madam Chair, and I know, if I may, we're all very frustrated with some things. I think Dr. Ansher's been challenged in her own way with federal and state restrictions, and is trying to do the best she can with this whole thing. So I'll just share that. I know we all want more to happen sooner. For example, a question you raised just a minute ago, we inquired of Dr. Ansher about the CVS situation. She submitted 3 sites. The CVS on Sudley Road, the CVS in Dale City, and the CVS on Route 1 by Potomac, Port Potomac. She didn't recommend Gainesville, so I don't know. We don't know where and why that came to pass. But she's well aware of where we're trying to focus our efforts and do the best we can. We've done that with the testing, and we're trying to do better here as we go along with the vaccinations. But I do hear you. It's been a very frustrating process all along.
So thank you, Mr. Meisner. Just 2 other quick things. You know, I want to point out, I mean, I know you guys have been working, and I know it's been getting so much better with the vaccines, and as we get more and it's becoming a rhythm, it was sort of a free-for-all at the beginning with the state. And so thank you for helping Dr. Ansher with that. You know, I know sometimes we all look to blame people when we want to when we're uncomfortable. And I think that in this case, it's just a lack of vaccines overall in general across the entire county, left over from last year. And I know that that's going to actually probably change hopefully over the next couple of months. I think we'll see more of those coming. And so I know when those do come, we'll be ready for that. So thank you for all you do. Thank you, Ms. Kitzmiller. I know you guys are working and have been working around the clock for almost a year now. Wasn't today the anniversary of our first case in Virginia, I believe?
First case in Virginia, I believe, and then March 7th was the initial
Right.
case reported at Quantico.
But, yeah. So, and I do want to, real quick question, someone asked, is it possible to, the hours end at 4 p.m., for vaccines, and that's sometimes difficult for working people to get to. Is there any thought, or could we just pass along about maybe extending those hours or doing something with regard to people who might need later evening hours? Is that a possibility?
Yes, ma'am. We'll take the request back, and we're hopeful that some of the contract support staffing that we're helping augment, some of those folks are part-time who are doing a couple extra hours, and they might be willing to
Yeah.
come stay a little later in the evening, so we'll certainly take the request.
Well, that was a concern expressed, so I thought I would just ask. Okay.
ma'am.
Well, thank you very much for all you do, and, if we all pull together in the same direction, I'm sure we will get where we need to go if we work together. So thank you very much.
Thanks for your support.